Hi everyone, I'm Dr. Sachin Ambekar, Director Minimal Access and Bariatric Surgical Department at MASH Hospital, Chirag Enclave, New Delhi. Today, there's a raging topic of obesity, and I think it's one of the most important topic today. Worldwide, adult obesity has more than doubled. In 2022, there was a survey which says 2.5 billion adults are overweight. Out of these, 890 million were living with obesity. 43% of adults above 18 years are overweight. Now, what is obesity? Obesity is actually a definition where there is a excessive body fat accumulation and which translates your BMI into above 30, which comes with calculated problems, risk factors, and serious diseases. And what I feel in today's world, obesity is just not a symptom, it is a disease. And WHO has definitely proclaimed this as an endemic proportion of a disease today in this world. And to counteract, in surgical terms, we have surgeries. In non-surgical terms, we have intragastric ballooning. And as you've learned now in the social media, we also have drugs approved by the FDA to lose weight. Today, I'm going to talk about all of this. So coming first, obesity, as I had already discussed, it is excessive body fat which translates your body mass index for above 30 and sets you on a path or a roller coaster ride of diseases. You have complications like cardiovascular diseases, heart attack, arthritis, knee joint pains, fatty livers, gallbladder stones, pancreatitis. These are the few conditions associated with the stomach. Above that, you have sleep apnea, you have less oxygen going to your brain, which causes even forgetfulness, lethargy. You have social stigmas. You are not able to move around. You cannot go to a simple movie where you're not fitting into the chair. You cannot travel a lot with airplanes having very small seats. So these are the few things which I feel the patients have come to me and told day-to-day struggling activities. Now, what is the solution? The solution is that we have two options. One is a non-surgical option and the other is a surgical option. The non-surgical option is called intragastric ballooning. And as you can see, I can show you, we have this capsule which is connected to a small stellate or a pipe. The patient comes in fasting in the morning. There are no cuts, there's no anesthesia. It's a 30-minute procedure. The patient swallows this capsule, which is as small as a normal capsule. In fact, it is smaller than a pizza bite. And within 30 minutes, when the x-rays confirm that this is in your stomach, we inflate and it becomes this kind of balloon. It's an intragastric balloon which fits into your stomach, and there's a program affiliated called SMART at MASH, which you can visit our website to know more about this. And this balloon fills in your stomach and it obstructs the food going in. So you have very less food going into your stomach and it causes an obstructive weight loss. The best thing about it is that there are no cuts. This gets disintegrated in 6 months and it goes through your normal passage of stools. You just have to do a weight loss program with our nutritionist, and over a period of 6 months you will achieve about 37 to 43% of weight loss with this balloon. And the best part about it is reversible, that suppose patients are there who cannot tolerate the balloon, we can remove the balloon. I think a lot of patients have now come and asked me, sir, that I don't want to go for a surgery. I'm afraid of a surgery. I've had horror stories regarding surgeries. I'm sure everybody is very scared of surgeries, but having said so, the solution is intragastric balloon, as I just showed you. And I have a lot of patients who come for ballooning. Now, what happens next? Now, I obviously feel that balloon is obviously a temporary solution. After 6 months, you might have a weight gain and you can have this balloon again after 1 year. But when it comes to surgery, yes, we have different options. The bariatric surgery performed for weight loss are sectioned into different kind of surgeries, and they are specifically tailor-made for every weight of your patient. So it's subjective of what your weight is and what your surgeon chooses for it. The most common is vertical sleeve gastrectomy, where we remove 80% of your stomach and there is a considerable amount of weight loss. We have a mini gastric bypass in which we make a small gastric pouch and connect the rest of the intestines to it, which is also nowadays used for super obese patients. We have Roux-en-Y, we have BPD, that is biliary pancreatic switch, duodenal switch. So these are the many surgeries which are performed by me for weight loss programs. But as I said, it is your choice whether you want to go for a surgery or you want to go for ballooning. Now, surgery, as I said, has a very good impact on the weight. It's a very permanent solution, and you're up and about within 48 hours after the surgery. We'll be giving you a specific diet for a month to follow. You have a dedicated program in which you will be in touch with us for 2 years, and it's a slow and steady win. You will go in for your weight loss. We'll be hand-holding you, and that's about it. So I feel in today's world, when you have so many options for weight loss, it is the right choice to be made at the correct time so that your fat doesn't falter into something complicated. Now, coming to the wonder drugs like Ozempic and many of the drugs which are there on the market, obviously it needs to be prescribed by a doctor. There is a steady weight loss for it. It has its side effects, but I think if explained well by a doctor, you have another choice of it. But again, it is subjective and selective for the patients according to their weight category. And the best part about it is that today, at the very crux of the matter where obesity is such a dreadful disease today, you have so many solutions. So at MASH, we provide everything. We have non-surgical and the surgical aspect to help you regain your health and confidence. Thank you.